Have you ever woken up in the morning feeling fine at first, only to stand up, take one step, and suddenly feel lightheaded? Your heart races, your balance wobbles, and for a moment you wonder if it's just age or something worse. If you're over 60 years old, I want you to know something important. That moment is not something to brush off because for many older adults I've treated over the last 30 years, stroke doesn't come with a loud crash. It doesn't always show up as slurred speech or collapsed limbs. No, it starts quietly with small things you ignore, like skipping water in the morning, jumping out of bed too fast, taking your pills with coffee, or brushing off that morning dizziness as just a bad night. I'm not here to scare you. I'm here to protect you. You see, many strokes don't happen by accident. They build up silently from daily habits most people believe are harmless, especially morning habits done before 9 a.m. That can raise your risk without a single warning. As a neurologist who's treated thousands of stroke cases in my career, I've seen how one small change in a patient's morning routine can mean the difference between independence and a wheelchair. The good news? You can change this, starting tomorrow morning. In today's video, I'll show you 7 small morning habits that may silently be raising your stroke risk. And more importantly, I'll show you how to fix them gently and safely. If you've ever felt dizzy in the morning or had an off day for no reason, please comment below. Type 1 if you felt it. 0 if you haven't. You are not alone, and your story might help another person watching right now. If this resonates with you, please subscribe to Dr. Brain. We're building a healing, trusted space for seniors where you're heard, respected, and protected. Now, let's start with the very first morning habit that could be quietly increasing your stroke risk without you even realizing it. Number 1, waking up too fast can quietly starve your brain. Can I ask you something a little personal? When you wake up in the morning, do you sit up slowly or do you jump right out of bed the second your eyes open? Most seniors I've treated over the years do the same thing. They rise fast. They feel fine until they take 2 steps and the room begins to spin. What they don't realize is that this small moment, those first few seconds after waking, can quietly put their brain in danger. Here's why. During sleep, your body is in a resting state. Your heart rate is lower. Your blood pressure is lower. Your circulation slows down, especially to the brain. Now imagine suddenly sitting or standing up. Your body hasn't adjusted yet. Your brain is still trying to catch up. This can cause something called orthostatic hypotension. It means your blood pressure drops sharply when you stand up. And when that happens, your brain may not get enough oxygen for a few seconds. For younger adults, that might just feel like a little dizziness. But for people over 60, with stiffer arteries and slower blood flow, it can lead to falls, memory lapses, or even trigger a mini stroke. Have you ever stood up too fast and had to grab onto something? That was not just getting old. That was your brain sending a warning signal, a small red flag that something's not flowing right. But the good news is, this is fixable, and it only takes 2 minutes. When you first wake up, don't rush. Take a deep breath, wiggle your fingers and toes, move your neck gently. Sit up slowly and pause. Let your legs dangle for a few seconds. Then, only when you feel steady, stand up and begin your day. This simple act is not about being slow. It's about being smart. I had a patient named Harold, age 72. One morning, he stood up quickly and fainted on the way to the bathroom. We found out he had been skipping this slow morning ritual for years. Once he started practicing this 2-minute habit, the dizzy spells stopped. He hasn't fallen since. So let me ask you now, do you rush out of bed in the morning? Have you ever felt that wave of lightheadedness? Share your answer in the comments because you never know who else might be feeling the same thing. And your story could be the sign that helps them stop before a fall, or worse. Your brain is wise. Let's give it time to adjust. And in the next section, I'll share the second most overlooked habit after waking up, the glass of water that could protect your brain all day. Number 2, the water you skip may be starving your brain. Let me tell you a quiet truth that most people over 60 don't hear often enough. If you wake up and go straight to your pills, your coffee, or your breakfast, without drinking even a sip of water first, you may be starting your day already dehydrated, and your brain, more than any other part of your body, feels it first. You see, while you're sleeping for 6, 7, even 8 hours, you're not drinking anything, but you're still breathing. You're still losing water through your skin, your lungs, even your mouth. By the time you open your eyes, your body is already short on fluids, and the brain, which is made up of roughly 75% water, starts struggling in silence. That morning fog, that sense of slowness or confusion. For many of my patients, it wasn't age, it was dehydration. And it only takes one glass of water, one simple glass, to begin fixing it. Drinking water first thing in the morning helps thin your blood. It improves oxygen flow. It restores the balance in your brain's chemistry. And for those of you who are taking blood pressure medication or diuretics like furosemide or hydrochlorothiazide, you're losing even more water overnight without realizing it. And that makes your blood even thicker in the morning. One of my patients, Irene, age 75, used to complain of cotton brain before breakfast. She'd lose her train of thought while buttering toast. Her blood pressure was under control. Her sugar levels were normal. But she was skipping water. Just 1 week after starting her day with a full glass of room temperature water, she felt sharper. Her headache stopped. And she said, "I didn't know something that simple could make me feel this alive." So here's my gentle advice. Before you reach for your coffee, before you take your morning pills, even before breakfast, reach for 1 glass of clean, room temperature water. Not ice cold, not gulp down, just steady, gentle hydration. That's your brain's first act of self-care. Have you already made this a habit, or is this something you're willing to try starting tomorrow? Let me know in the comments. And if you have your own way of remembering to drink water first thing, share it. You might help someone else watching right now. In the next part, I'll talk about something that's sitting on most seniors' breakfast plates and why it may be quietly pushing up your blood pressure even before you finish your first bite. Number 3, the hidden salt in your breakfast that may be raising your stroke risk. Let's talk about your breakfast plate. What's usually there in the morning? Maybe some toast, a bowl of cereal, eggs with a little cheese, or even a few slices of turkey bacon. It sounds pretty normal, even healthy, right? But here's the part most people miss. Many common breakfast foods are packed with hidden salt. And for people over 60, that quiet salt load in the morning could be putting dangerous pressure on your brain without you even tasting it. See, right after waking up, your body goes through what we call the morning surge. Your blood pressure naturally rises during the first 2 hours after you open your eyes. Now, when you eat a salty breakfast during that surge, it's like throwing gas on a fire. That extra sodium stiffens your blood vessels. It forces your heart to pump harder. And in aging brains with fragile capillaries, that's a recipe for micro tears, memory loss, or even stroke. Let me give you some surprising examples. A single slice of packaged whole wheat bread can contain over 150 milligrams of sodium. A bowl of flavored instant oatmeal, around 250 to 300 milligrams. Just 2 small turkey sausage links, more than 400 milligrams. And that's before you add cheese, butter, or anything from the toaster. The American Heart Association recommends adults consume no more than 1,500 milligrams of sodium per day if they are at risk of high blood pressure or stroke. And yet, many seniors are getting more than 600 milligrams before 9 a.m. That's almost half the daily limit before the day even starts. One of my patients, John, age 68, was proud of his light breakfast, toast, eggs, and turkey sausage. But after he experienced a sudden dizzy spell, we reviewed his diet. He was getting more sodium in the morning than I recommend for the entire day. He made a few swaps: plain oatmeal with berries, boiled eggs without sausage, and avocado instead of cheese. Within 2 weeks, his blood pressure dropped 10 points, his energy improved, and he said, "Doc, I didn't realize my breakfast was stressing out my brain." So here's my suggestion. Look at your breakfast labels. Try to keep your entire morning meal under 300 to 400 milligrams of sodium. Choose fresh over packaged. Season with herbs instead of salt. Swap processed items for simple ones like boiled eggs, fruit, or plain toast with olive oil. Have you ever checked how much salt is in your breakfast or made any low sodium swaps that worked for you? Share your ideas in the comments. Your tip might help someone else right now. In the next part, I'll reveal the one drink most people trust to wake them up. Yet, when taken the wrong way, it can silently raise your risk of stroke. Number 4, the morning cup that may be spiking your stroke risk. Let me ask you something honest. Is coffee the very first thing you reach for in the morning? If so, you're not alone. Most of my patients say the same thing. "Doc, I can't start my day without coffee." I understand. That warm cup feels like life itself. It gives you energy, comfort, routine. But here's what you need to know. Drinking coffee on an empty stomach, especially first thing in the morning, can quietly raise your stroke risk. And here's why. Caffeine, especially in large amounts or without food, causes a spike in adrenaline. That means your heart rate increases, your blood vessels tighten, and your blood pressure can jump, sometimes by 10, 15, or even 20 points in just minutes. That's fine for a 25-year-old jogger. But for someone over 60 with slower circulation, less flexible arteries, or a history of hypertension, that jolt may overwhelm your system. I had a patient named Walter, age 74. Every morning, he skipped breakfast but drank 2 cups of strong coffee. He felt fine, until one day he experienced sudden heart palpitations. We ran tests. His blood pressure had spiked. His neurologic exam showed signs of a possible transient ischemic attack, a mini stroke. We changed one thing. He drank water first, had a light breakfast, and then 1 cup of coffee. The palpitations never came back. He told me, "I still get my coffee, but now my brain thanks me for it." So what should you do? Don't give up coffee. Just be smarter than your routine. Start your day with a glass of water. Then eat something light, like oatmeal, fruit, or eggs. Then, and only then, enjoy your coffee. And limit it to 1 moderate cup. Skip the triple shot lattes, the extra sugar, and the flavored creamers. Your brain doesn't need the extra stress. Do you still drink coffee on an empty stomach? Or have you already changed your habit? Leave a comment below and let me know. Your experience might help someone else make a better choice tomorrow morning. In the next part, I'll talk about one of the most ignored signs your brain is in trouble: morning dizziness, numbness, or speech issues that disappear in minutes, but should never be ignored. Number 5, the subtle morning symptoms that could be your brain's quiet cry for help. Have you ever woken up and just felt off? Maybe your balance was strange. Maybe your arm felt weak for a moment. Maybe your words came out slower than usual and then returned to normal. Most people shrug it off. I probably just slept wrong. Or maybe I'm still waking up. But from my 30 years of practice, I can tell you, those little moments may be your brain's way of whispering for help. What you felt might have been a transient ischemic attack, what we call a mini stroke. A mini stroke doesn't always knock you down. It may last only a few minutes. You might not even realize it happened. But it is one of the most important warning signs your body can give. especially in the morning. Here's why. In the early hours after waking, your body shifts from rest to full function. Your blood pressure climbs, your heart works harder. And if you already have narrowed arteries or poor blood flow to the brain, this shift can become unstable. Suddenly, your brain may not get enough oxygen. And that's when small, quiet symptoms appear, like dizziness, weakness, or momentary speech difficulty. I once treated a woman named Marlene, age 69. She woke up one morning and couldn't find the right words to speak. It lasted 3 minutes. Then everything returned to normal. She almost didn't come in. But when she did, we found early signs of carotid artery narrowing right before a major stroke could have happened. Marlene's story is why I urge you. If something feels off in the morning, don't ignore it. Write it down. Tell someone. Call your doctor. Track your symptoms with a simple notebook or app. Because with a stroke, time is everything. Your brain doesn't yell right away, it whispers. So let's learn to listen. Have you ever experienced something like this? A strange feeling in the morning that went away but didn't feel right? Please share your story in the comments. You might help someone catch the signs early, before it's too late. In the next section, we'll talk about something millions of seniors do each day, taking morning medications, and how the way you take them could be helping or quietly hurting your brain. Number 6, your morning medications may not work if you're taking them the wrong way. Can I ask you something practical? How do you take your medications in the morning? Do you take them at the same time every day? With a full glass of water? Do you eat something before or swallow pills on an empty stomach? And here's the big one. Have you ever forgotten if you already took them and then taken them again? If any of these sound familiar, you're not alone. Medication mistakes are one of the quietest dangers I see in seniors over 60, and they often show up as symptoms that seem unrelated. Sudden dizziness, drop in blood pressure, fatigue, even brain fog or memory slips. And the problem isn't always the medication itself. It's the timing, the routine, and how you take them. Here's what I mean. Many seniors take blood pressure medication in the morning. Others take statins, blood thinners, or diuretics. These are powerful tools, your brain's silent protection against stroke. But taken on an empty stomach, the effect can be unpredictable. Taken with coffee instead of water, it can delay absorption or increase side effects. Taken without consistency, it can throw your whole system off balance. I had a patient, Ron, age 71. He would take his meds whenever he remembered, sometimes at 7 a.m., sometimes after lunch, and when he felt dizzy, he assumed it was just aging. But his inconsistency was causing daily blood pressure swings. We made just a few changes. He started using a simple pill organizer with morning, noon, and night slots. He set an alarm reminder. He took his pills with food and only water. Within 1 week, the dizziness disappeared. His blood pressure stabilized. And for the first time in years, he said, "I feel normal again." So here's my advice as someone who's seen this too many times. Make your medication routine as regular as your morning coffee. Keep your pills near something you never forget, like your toothbrush. Use alarms. Use pill boxes. Ask your doctor before making any changes. And never ever double a dose unless told. These medications are doing quiet, powerful work for your brain. Let's give them the best chance to help you live long and live well. Have you ever missed a dose or taken a double by accident? What helps you remember your morning meds? Share your routine in the comments. Someone else might need exactly what works for you. Next, I'll talk about a habit so common, almost nobody questions it. But holding in your morning urge to go to the bathroom might be raising your stroke risk without you realizing it. Number 7, delaying your morning bathroom trip could quietly strain your brain. Now, this may sound surprising, but what if I told you that holding in your morning urge to use the bathroom could be quietly stressing your heart and brain before your day even starts. I know it sounds small. You wake up, you feel the need, but you think, let me just check the news first, or I'll wait until after my coffee. It feels harmless. But for those of us over 60, it's anything but harmless. Here's the truth. When your bladder is full, it doesn't just sit there. It starts to trigger stress hormones, especially cortisol and adrenaline. These hormones are part of your body's fight or flight system, and they raise your blood pressure. They tighten your blood vessels, and they can even cause irregular heart rhythms in sensitive adults. This early morning spike, combined with everything else you've heard so far today, dehydration, coffee, hidden salt, and skipped medications, can quietly push your brain into a danger zone. I once had a patient named Shirley, age 76. She liked to lie in bed for 30 minutes after waking up, even when she needed to go. She said it helped her ease into the day, but one morning she felt lightheaded and collapsed on the way to the bathroom. When we reviewed her habits, the pieces became clear. A full bladder, morning dehydration, and delayed movement caused a dangerous pressure spike. We didn't need medication. We just changed her first action. She began going to the bathroom right after waking. And since then, no more lightheaded mornings. It became her new ritual. I pee before I pick up my phone. So here's my advice. When your body sends you that morning signal, listen to it. Get up. Go. Don't delay with the news, coffee, or scrolling. This isn't just about comfort. It's about your heart and brain. A full bladder puts pressure on your system, and ignoring it may quietly increase stroke risk, especially if you already have high blood pressure or heart rhythm issues. Have you ever delayed your morning trip to the bathroom? What helped you change that habit? Leave a comment and share your story. It might encourage someone else to make that one small but powerful change. And now that we've gone through all 7 of these subtle morning dangers, in the final section, I'll help you tie them together and show how just 1 or 2 small changes each morning could protect your memory, your balance, and your independence for years to come. Number 8, small morning habits, lifelong brain protection. Let's take a deep breath together. You've just learned 7 morning habits, and each one, on its own, may seem small, but together they form a quiet pattern, a silent strain on your brain, your heart, your balance. The truth is, stroke doesn't usually happen suddenly. It builds. 1 skipped glass of water, 1 rushed step out of bed, 1 salty breakfast, 1 missed pill, 1 ignored moment of dizziness. And then, one morning, you wake up and everything has changed. But here's the part I want you to remember most. You are not powerless. Your brain is wise, and you can begin protecting it, starting tomorrow morning. You don't have to change everything all at once. Start with one thing. Wake up slower. Drink that first glass of water. Check your salt. Time your pills. Listen to your body. Give your brain the support it needs, not just to survive, but to stay sharp, strong, and independent. This isn't about fear. This is about freedom. The freedom to live on your own terms. The freedom to keep your memory. The freedom to hold your grandchild and know their name. That's the power of small choices made every morning. If this video gave you just one helpful insight, please give it a like and share it with a friend who might need it too. Your small act today might protect someone else tomorrow. I'd love to hear from you. Which of these 7 habits surprised you the most, and which one will you start changing tomorrow? Let me know in the comments, and don't forget to subscribe to Dr. Brain. We're here to help you protect your brain before it needs saving. In our next video, we'll dive into something just as important. Over 60? This one sweet, juicy habit could raise your risk of stroke overnight. You don't want to miss it. Until then, Take care of yourself each morning. You matter more than you know. Let me leave you with this thought. You don't need a complete lifestyle overhaul. You just need a little awareness every morning. Because stroke prevention doesn't start in the hospital. It starts in the quietest moments, before breakfast, before movement, before you even speak. And those moments belong to you. Your brain is more resilient than you think, but it needs your help. So tomorrow morning, start small. Breathe slowly. Sit up with care. Drink your water. Check your salt. Take your meds with intention. And above all, listen to your body. It's wiser than you know. Now, if you've made it to this point in the video, thank you. You've just taken a powerful step in protecting your brain for the long run. And if this video helped you in any way, please give it a like. Share it with someone you care about. And don't forget to subscribe to Dr. Brain. Because here, we're not just treating problems. We're building quiet victories every single day. Now, if you're over 60 and you exercise regularly, you might think you're doing everything right. But did you know there's one specific exercise that may be silently straining your heart and brain, especially if done wrong or at the wrong time? Before your next workout, you need to see this. Over 60? This exercise raises stroke risk overnight. Click it now. Your brain might thank you later.